again. So I decided to do a little video diary update on Gracey. So back in December, we had discovered a tumor on her chest, which turned out to be benign. However, it is quite large. Since then, she's been displaying some other clinical symptoms of some other issues going on. So Gracey's actually here for an ultrasound today. Gracey, come here. I'll show you a little bit of an update here. I'm not sure if you can see. So, come here, girl. Okay. So, this is her lump, and where we biopsied it actually herniated some fat through. So now her lump has a lump that is reducible. So we're closely monitoring the growth of this. She has started peeing all over the house, and she pants excessively, like you can hear. She's also very hyper. And her liver enzymes and her pancreas enzymes are slowly climbing high. So she's getting an full abdominal ultrasound today to kind of hopefully determine what's going on with her. So we'll see how this goes.
It's okay, baby. Just a little haircut. It'll grow back. Good girl, Grace. Good girl. Okay. Yep. So we're doing an ultrasound on Gracey today because Gracey's had some changes in her liver that could be suggestive of liver disease or a disease called Cushing's disease, which is an overactive thyroid gland. So, you know, we have the means, so we're going to do the ultrasound today just to check out her liver and adrenal glands and make sure that nothing else is going on. See if we can get a diagnosis today. So ultrasound basically is the formation of an image on the computer, and it's caused by sound waves, which is why it's called ultrasound. So what happens is I have my transducer here that has a crystal inside, and the crystal vibrates and makes sound waves, and the sound waves travel when I put the probe on Gracey into her abdomen, and it hits the organs, and then the sound waves bounce back to me or make echoes, and my probe reads those waves that are bounced back and then makes a 2D image for me on the machine. Ultrasound is different in x-rays in that x-rays use radiation to get their images, where we're using sound waves. There's usually, you know, there's no side effects or any risks associated with ultrasound, which is nice. It's a very non-invasive test. We sit in the dark. I basically run the probe on her belly. Most people have had some ultrasound or know somebody who had an ultrasound in their lifetime. And so it's very non-invasive test that gives us a lot of information. Gives us different information than an x-ray. So an x-ray will give us the shape of the liver and the overall outside appearance of the organs in the body, whereas so all I see is more the surface. It's good for seeing like liver enlargement and spleen enlargement, organ enlargement, lung changes, things like that, but I only see the outside surface. Ultrasound actually lets me take, so it'd be sort of like looking at the outside of the cake. Ultrasound lets me look at the internal structure of the organs, so it'd be like slicing a piece of cake out, pulling it out, and looking at the side of it. I can take actual slices of the organs and see them, and I can see their architecture, which also find disease and things like that. So that's ultrasound in a nutshell, and we're going to get started. She's going to be better probably than most of my sedated patients. Thanks to Mom poking and prodding her.
Yeah, Gracey's a very cooperative patient.
Sure, Steph, if you can see the screen, because I have it turned towards me.
Yeah, I can zoom in on it here. There we go.
So what we're seeing here, first shot is Gracey's liver. So this is one of the lobes of her liver. This is her diaphragm coming into view here, so I know that I'm seeing the whole lobe of that liver. And I can see all this architecture, so I can see the blood vessels running through the liver. You know, if there was a mass there or a tumor there, I would see a mass inside the structure of the liver. And so, you know, this is the 2D image that we get. And it sort of looks like an optical illusion, like those 3D books that you used to have out there where you had to adjust your eyes to see the picture properly. When you don't know what you're looking at, and when you do know what you're looking at, it's really clear what we're seeing. So Oh, you can actually see her diaphragm and her heart beating on the other side of it. Alrighty. Good job, Grace.
So we just finished Gracey's ultrasound. It took a little over an hour, which is pretty common for a larger breed dog. She did very, very well throughout the whole thing. She actually fell asleep at one point, so that's good. Sometimes we have to sedate, so she was fasted overnight, just in case we had to go that route. We did good. So preliminary results show that her liver has a couple of spotty areas, a little enlarged, and one of her adrenal glands looks to be enlarged. So with ultrasounds and x-rays, we actually send them off to a radiologist for detailed analysis. We're going to get that back. And the next step for her is some blood work, which we're going to perform next week. It's a specialized blood test that has to be sent out to a lab, so we need to order some special things for that. So I will keep you posted on how things go. Meanwhile, she's acting happy, and we're going to keep on keeping on. I'll keep you posted.